what is the average cost of this entire procedure? Is it like heavy on the pockets of the people or the couples going for it, or is like bear kar sakte hai?
IVF is of course a little bit expensive treatment. So approximately one cycle of the IVF in India cost around 1,25,000 to 1,50,000. These are the approximate charges. Of course, those require special treatment. The cost of IVF might increases, and during even IVF pregnancy, if any problem is happening, then a couple need to spend some money. So if someone is going through IVF treatment, I would suggest you should be financially secure before starting the IVF treatment. And there are a lot of EMI schemes available, so you can always go for that. So it will cause less burden on you if you are undergoing IVF treatment.
Ma'am, what are the side effects of this IVF treatment?
So IVF treatment is very safe. आपको कोई घबराने की ज़रूरत नहीं होती अगर आप IVF का ट्रीटमेंट कर रहे हो तो. Very minor side effects like headache, mood swings and very minor abdominal pain can occur because of the hormonal injection during IVF. Very rarely there are chances of injury to vital structure during the ovum pickup process. It is very rare, and if you are undergoing a treatment with a competent doctor and a good center, this complications are very less likely to occur. And one of the very less commonly occurring complication, which is known as ovarian hyperstimulation syndrome, can occur because of the hormonal injections. So this risk of the OHSS, that is ovarian hyperstimulation syndrome, was more. Like previously they were using different kind of protocols during IVF cycle, but with new protocols and with frozen embryo transfers, the chances of this OHSS is very rare. I would say less than 1%. So practically it is not happening nowadays if everything is controlled and if the doctor is monitoring the cycle well.
Ma'am, are there any chance of miscarriages by this treatment also?
So if someone is conceived with IVF, so अगर किसी को miscarriage हो सकता है या नहीं हो सकता है, वो भी एक बड़ा question है. I would say of course miscarriage can happen even after IVF treatment. If the chances of miscarriage depends on age of the couple, the genetics of the couple, and if the female is suffering from APLA syndrome or thrombophilia, the chances of miscarriage are higher.
And if a couple is not able to achieve success in the first try or the first go, can they do the procedure all over again?
जैसे अगर आपका एक IVF ट्रीटमेंट सक्सेसफुल नहीं होता है तो आप अगेन ट्राई कर सकते हो या नहीं, ऐसा बहुत सारे कपल मुझे पूछते हैं. I would say of course you can retry. There is no harm in retrying the treatment. Okay. Of course अगर आपका एक बार IVF फेल हुआ है तो हम दूसरी सारी ट्रीटमेंट्स भी आपको ऑफर कर सकते हैं, so which can improve the chances of successful pregnancy. But of course you can retry. There is no upper limit कि आप कितनी IVF cycle कर सकते हो.
And are the babies healthy, those who are conceived via the IVF treatment?
जो IVF babies रहते हैं वो और अगर कोई जो बेबी है वो नॉर्मली कंसीव है, वो दोनों सेम ही रहते हैं. देयर इज़ नो चांस कि IVF बेबी है वो अनहेल्दी होने के चांसेस है. टिल डेट इन वर्ल्ड देयर आर मिलियंस ऑफ IVF बेबीज हैज़ बीन डिलीवर्ड, and the oldest IVF baby, whose name is Louise Brown, she is 43-year-old now. एंड इनिशियली जब IVF बहुत नया था तब बहुत सारी स्टडीज़ हुए हैं जो IVF के बेबीज़ है उसका लॉन्ग टर्म फॉलोअप भी हुआ है कि उनका ग्रोथ कैसे होता है इन लेटर लाइफ, how their milestones are there, and everything is studied, and there is no statistical significant difference between babies who are born with IVF and who are naturally conceived. So they are as healthy as those who are naturally conceived, and there is no even chances of increased birth defect in the IVF babies.
मैम, जो कपल्स IVF ट्रीटमेंट ऑप्ट करते हैं उसमें से जो वुड बी मदर है, क्या उनके लिए कंप्लीट बेड रेस्ट सजेस्टेड होता है और दे कैन बी एज एक्टिव एज द पर्सन कंसीविंग थ्रू नॉर्मल प्रेगनेंसी?
सो अगर IVF का ट्रीटमेंट हो रहा है तो आपको बेड रेस्ट लेने की कोई ज़रूरत नहीं रहती है. ओके, वी माइट एडवाइज होम रेस्ट और वी माइट एडवाइज यू टू टेक लेस स्ट्रेस ड्यूरिंग द ट्रीटमेंट, because it might improve the chances of the pregnancy if you take less stress during the treatment. But of course there is no need for complete bed rest during the IVF process. So even जो IVF की मेडिसिन्स रहती है जो इनिशियल पार्ट में हम प्रेगनेंसी के सपोर्ट के लिए देते हैं, वो भी धीरे धीरे करके अप्रॉक्सीमेटली अराउंड 10 to 12 वीक्स तक वो सारी बंद हो जाती है. देन it is more like the natural pregnancy only, so there is no need for special rest during especially IVF pregnancy. But of course if there are any problem during the the course of the pregnancy, which can occur to anyone, like even if those who are naturally conceived, they can have those kind of problems and they might need some rest if it is advised. Like if someone is having preterm labor or something like that, they might need the rest. But it is completely absolutely 100% sure that अगर आप IVF से प्रेगनेंसी कर रहे हो तो कंप्लीट बेड रेस्ट की जो नेसेसिटी रहती है वो नहीं रहती है.
Ma'am, what are the do's and don'ts for the couples or the parents who are undergoing the IVF treatment?
So lifestyle changes, a good nightly sleep, try to avoid the stress if you are undergoing IVF cycle. It is of course going to help you during the cycle and during your pregnancy. That you should stop smoking. There shouldn't be like alcohol consumption during the treatment for like both the partners. There shouldn't be excessive caffeine intake, not more than 200 milligram per day during the treatment and even after that during the pregnancy. Specifically for the male partner, they should try to avoid putting laptops in their lap, because that will lead to excessive heat generation and it might affect their sperm count. Otherwise, I would suggest healthy diet which is rich in whole grains, good fats and high in protein. It is going to helpful. A diet which is rich in folic acid, which is like green leafy vegetables and antioxidant, which it's of course going to help with the treatment outcome. So they say that Mediterranean diet is ideal fertility diet, so you can opt for such diet. And I would suggest to avoid ultra processed and packaged food, and refined sugar should be avoided during the treatment. Otherwise, anything which is homemade, anything which is fresh, and anything which is local is going to helpful.
Ma'am, what are the indications of IVF other than the inability to conceive?
So IVF जैसे जो कपल रहता है कि उनको जिनको बच्चे नहीं होते हैं सिर्फ इनके लिए है ऐसे ज़रूरी नहीं है. But IVF is a helpful treatment in those who are suffering from recurrent miscarriages, those who are suffering from genetic disorder like thalassemia. So in those couples, IVF is going to help them to select the healthier embryo and that will give them a healthy baby. Secondly, those male or female like who just want to delay their fertility, who are not having a partner currently right now, or who don't want babies right now and but might want babies in the future, they can opt for egg freezing or semen freezing. So in future they can have their own biological children. And very important indication of the IVF is the cancer treatment. A female or a male who is undergoing a cancer treatment, they can just preserve their eggs or their sperms before starting the chemotherapy and the radiotherapy, because of course after the chemotherapy and the radiotherapy, the gametes, the eggs and the sperm are going to be like reduced, and sometimes there could be this premature ovarian failures in females who are undergoing cancer chemotherapies. So it is a very good option for the fertility preservation. Even a couple who is already having one child but they don't want a second child right now, but in future they might want a second child, they can even go for their embryo freezing and they can have their second child whenever they are ready. Then other indication for IVF, like it is not popular in India, but still a same-sex couple, those who are gay or lesbian, they can be parent with the help of IVF. And even a single mother or the single father, if they want to be a parent, they can choose IVF and they can have their own babies and own families.
If you are a keen learner and would like to have knowledge on the go while eating, drinking, exercising or cooking, then listen to our podcast, The Doctor's Dictionary, on Google Podcast and Spotify.